All right, good afternoon, everyone, and thank you for joining us for our second session today on the second day of the SCID Compass Summit. We are looking forward to our next speaker. Joining us today is Brianne Miller, Program Manager of Newborn Screening Initiatives at Expecting Health, and she is going to host a discussion about navigating family planning with SCID. Welcome, Brianne.
Thank you, Emma. I'm so excited to be here sharing with you all about the work we've done around family planning after having a child with SCID. My name is Brianne, as she said. First of all, I just want to say that this project was supported by HRSA, so I want to say thank you to them for funding this work. Also, before I dive in, I just want to take a moment to say thank you so much to the parents that took their time to candidly and vulnerably share their experiences with us. You'll hear a bit more about the interviews we did as I go through my presentation, but I just want to acknowledge that it's not an easy subject for everyone to talk about, and it's really, really personal. So thank you to all of the parents that took the time and willingly did so. So an overview of what we'll be talking about today is why this project, what we did, what we learned, and what's next. So we'll kind of go through these questions throughout my presentation. First of all, as a background, and why we got into this project is, as most of you probably know, SCID affects 1 in 58,000 babies born in the United States, and thankfully, it is now screened for in all 50 states as a part of routine public health newborn screening, meaning almost every baby born in the United States each year is screened for SCID shortly after birth. We know a lot about what happens when we screen for SCID in the first few days to the months after birth, but there's not a lot of information out there for what happens after we screen for these children, identify them early on in life, and get them the treatment that they need. What happens after that for a family? So that is what we wanted to answer with this project. Our goal was to conduct individual interviews with parents of a child with SCID in order to identify and address resource gaps around family planning after having a child with SCID. So beginning this project, we created an interview guide. It had kind of 9 overarching questions or sections that we went through with each of our interviewees. And then each question that we asked had several probing questions that followed up to it to get a little bit more information and dive a little bit deeper into the topic we were getting at. These were kind of broken up into these 4 sections here on the screen. And we provided each interviewee with an introduction, kind of sharing what we were hoping to learn from them and why we were doing this project. Asked about their family planning story to date and kind of what they were thinking about moving forward, positive and or negative aspects of that experience, and resources for family planning, asking them kind of where did they go, where would they go, who did they talk to, and what resources do they have or would they like to have. So we conducted these interviews with 9 parents of children with SCID, and these were done in April of 2021, which feels so long ago now, but also feels like it was just yesterday. So we did them all online via Zoom. They were all recorded and then transcribed afterwards so that we could go through and code them. After the interviews were completed, they were de-identified for coding and analysis. So after the initial interview, we had no names or identifiers in transcripts, and our participants were also compensated for their time. So one of the first things I want to lay out before we go into the more specific findings from our interviews is that we had interviewees from all kind of different spots on this, what we like to call the spectrum of family planning. We had a participant who was in early conversations about having additional children, this participant at the time was actually still in the hospital with their first SCID baby, but they wanted to kind of start having those conversations early and see what their family planning journey would look like. So we were able to talk through that with them. We had several participants somewhere in the middle of actively trying for additional children to had already had additional children. That was where most of our participants were either somewhere between beginning to pregnant or had additional children already. And we also had one participant who we said had a complete family, and they had no desire to have additional children after having their child with SCID. So we kind of got to hear all different perspectives on from really just starting to think about if they wanted to have additional children all the way through deciding not to have additional children. We also uncovered early on in the process that there are so many different paths families can take to plan for additional children. As I mentioned, one of those paths is to decide that their family is complete and they don't want to have additional children. But other paths that we encountered in the interviews were surprise natural conception, meaning they weren't necessarily intending to get pregnant, but it happened. Others had a planned natural conception. We had a family in the process of planning the adoption of a child, and also a few different kind of IVF experiences, those planning for IVF and those who had already had additional children that were conceived using IVF. So we had these two different factors to really kind of put context around the different interviews. And we learned really, really quickly that everybody's experience is so different with family planning after having a child with SCID. There's definitely themes we can draw across the interviews, but we also had to be really conscious of the fact that everybody had different wants and different paths of getting to those wants. So just kind of keep that in mind as we go through. So for analysis, we concluded all of the interviews and we deductively developed a code book to analyze the interview transcripts. This means that it took us some time to really read the transcripts and figure it out. And that spectrum of family planning and the different paths for family planning were two reasons that we really needed to kind of sit with the data for a while to develop our code book. We had developed a code book prior to the interviews and decided that it wasn't going to work and wasn't going to help us really tell the story of the data. Our code book was used to code each transcript and highlight the key themes or areas of similarity. And then two team members coded each transcript, and then we kind of came together to say, I coded this sentence as this, I coded this as this, like what are we really trying to get at here, and is that right and accurately reflecting the data? Here is just a example of a few of the codes that we had in our code book. On the left is kind of the overarching category, and then on the right is the actual code. So for example, this influences on family planning decisions. We noticed that there were a lot of motivators that parents described to have additional children, but they also described certain things that maybe deterred them or made them kind of think a little bit longer about having additional children. So we separated those out, coded them as either a motivator or deterrent, but understanding that overall they went into this bucket of influences on family planning decision. A few of the other codes we had were social support, resources about specific aspects of having a child with SCID or family planning afterwards, financial costs, and healthcare providers. So you'll see some of these in the data I'm going to share in a little bit. So for findings, our first finding was that every parent had a very different experience with their child being diagnosed with SCID. We weren't really looking to find this information. Our interview guide wasn't specifically designed to ask questions about the SCID diagnosis, but we quickly found out that it was a very key part of a family's family planning journey after having that child with SCID. The positives of having a child with SCID and the harder times of having a child with SCID really kind of weighed on them in different ways, and definitely weighed into their family planning decisions. And so I have some quotes from the interviews that I'd like to share that kind of highlight this. So this says, and we live in a state, and at the time that their child with SCID was born, that state wasn't screening for SCID via newborn screening. So they had a little bit of a different SCID diagnosis experience than most children would have today. And that was something that really impacted their journey with SCID, because they found out a bit later than they would have anticipated or hoped for. Here's a quote about being a carrier. When you're a carrier because you have your child's diagnosis and then your own diagnosis, what are you going to do with that information? And another quote from another interview is, since I wasn't a carrier, he said it was likely just a random mutation in him. But I think the doctor kind of expressed that the chances of having another SCID baby were really, really low. So you'll see here that the top quote is from a parent having a carrier diagnosis as well. And that also is part of that SCID diagnosis journey, finding out if the parent is a carrier. And that really impacts their decision of how to have a child, or if they want to have another child in the future. Whereas the parent on the bottom was told that they weren't a carrier after doing carrier testing. And they were told by their doctor that the odds of having another SCID baby were really, really low. So they weren't thinking so much about what their carrier status meant for their future children. And this is about kind of experiences with treatment. The parent on the top is saying he's 100% healthy, goes to school, eats dirt, like shopping cart handles, is a typical young kid. And he's actually seems to be healthier than his peers. And then another parent had an experience where their child ended up in the ICU for 15 days on life support. So more so kind of the smoother aspects of treatment and those harder aspects as well. And you could really hear in the interviews the parents describing how those experiences and how their child was doing with SCID impacted their family planning experience and decisions. The next thing that we found was that a family planning decision is not something that you just have one factor and decide, I do or I don't want to have another kid, and this is how we're going to do it. It's something that these parents are thinking a lot about, and they're thinking a lot about different factors. Some of the factors that they're thinking about, which you'll see in the quotes coming up, are cost, the health of their child, the health of their future child, mental health, the ability to just care for their future children and their SCID child at the same time. All of those things are kind of weighing on families. So here's a quote. In terms of having another child, I really wanted to have another child. I wanted her to have a sibling. I wanted her to have somebody, when my husband and I are gone, that can, be there with her. So this mom is just saying how much her just wanting to have another kid was an important factor in their decision, which I think is a really big factor for some families. I think that's partly because of the smooth recovery that we did get back to somewhat of a normal life, actually more normal than what life is right now when he was like 6 or 7 months old. This quote came from a conversation kind of in the context of talking about the COVID-19 pandemic, and saying that after their child was treated for SCID and had got the treatment they needed, they came home and everything seemed great. But now, in the midst of the COVID pandemic, like everything seems so much more crazy than that time did. And that kind of smooth transition from diagnosis to treatment to home was a really important factor for this family in deciding whether or not to have additional children. Um, and so then he was worried we were going to have to put her back in isolation. She's not going to be able to socialize. She survived. The second child might not survive, Is our marriage even going to last through another medical, trauma like this? This quote is a really good one and a really heavy quote of a mom really just kind of thinking through a lot of the thoughts that were going into her mind about having an additional child. Um, yeah, and I like to just kind of sit with that one for a while. And then this quote really kind of highlights the thought of cost, especially around IVF. I was really hesitant to go through IVF because I also didn't want my daughter to think that there was something so wrong with her that we would spend $30,000 to avoid having another child like her. Something parents talked about frequently was the cost of having additional children after SCID, whether that cost be related to carrier screening, IVF, other health care that they needed. Several families discussed the cost with us, and $30,000 kind of seems to be the general number that came up a lot to go through IVF. So that's really, really expensive, and that is a really big financial burden on a family. So that was something that came up a lot as well. And then also this thought of, I didn't want my daughter to think that there was something so wrong with her. So again, really thinking about their SCID child and their feelings and kind of weighing those as well. And the third finding that I'll talk about today is a lack of family planning support and resources. We heard over and over again from our parents that we interviewed that there really just wasn't a lot of support for them in that space. They kind of found themselves wishing there was somewhere to go or something to do that would support them in making the decision that they were facing. So here is kind of another quote that illustrates the cost and also a lack of support in the insurance factor. So the one on top was talking about having Federal Blue Cross Blue Shield, like a really major large insurance company, and they won't cover IVF. So that family found themselves having to decide if they wanted to take out a loan or not. And the one on the bottom discussing none of the benefits are triggered without an infertility diagnosis. So my dream would be for the benefits to be triggered by an infertility or a genetic carrier diagnosis, because I'm still not getting all of the coverage. Like my insurance would cover up to $5,000 in medication support. So explaining that infertility would have been covered for IVF or the treatment that this mother was, but because of being a genetic carrier isn't considered by the insurance company to be similar or a like diagnosis that would trigger those benefits. This mother was missing out on the insurance benefits that could have really helped them throughout this process. And this is a talk about an experience with a genetic counselor. I spoke to him just because he's a genetic counselor. I thought maybe, and he shocked by his response, because he was like, you cannot have a child into this world just to like be giving their bone marrow to your other child. This quote is really heartbreaking to me, and I'm sure it is to others. But the lack of support for having additional children and wanting to make sure, if the parents decide to, make sure that their second child is a bone marrow match for their SCID child, um, was something that was described pretty frequently as not being well received and um, received in this manner. And then this quote just kind of sums it all up, I think. People want to be able to make the choice that's right for them. And it just seems that there's not really support in that area. After going through all of those quotes from parents, at the end of the day, they really want to just be able to decide, weigh all of those factors, and at the end of it, decide what is best for them and their family. And it came up over and over again from the parents that there just wasn't really support for them in feeling that that was okay, and the decision that they chose to make was the right one. So we quickly recognized that the need after these interviews is a resource to support and encourage families during their family planning journey after having a child with SCID. So we came together as a team and we developed this one-page resource. It's called Thinking About the Future. And the front has a lot of information that I've kind of walked through with you all. The bottom is kind of those paths of family planning: natural conception, in vitro fertilization and adoption, or a complete family, and has different points to consider under each one. And then it also has key considerations of what parents should be thinking about prior to making their family planning decision. What information do they need to know? And those questions are mostly, what type of SCID does my child have? Am I a carrier? Is my partner a carrier? And really kind of having that medical information to kind of kickstart their family planning journey. And then on the back, we have a series of questions, which I'll dive into a little bit more in a bit, that kind of really encourage the families to think about what factors are most important to them as they go through the family planning process, and to encourage them to kind of write them down, talk about it, and think through that for themselves. So you can see here at the top, we also included a quote from a mother, which I think is such a great quote. And it says, "Don't let other people who don't know what's going on in your lives and in your medical lives hinder your thought process on whether or not to have children." This mom, I thought, gave such great advice. She also, I believe, said, if you want to have one child, great. If you want to have two children, great. If you want to keep going and have as many children as you want, that's perfect. Have as many children as you want, and don't let others kind of make you feel bad for that. And I really appreciated that advice, and we thought it was great advice from another mom, so we included it on the top of the page here. So here's a closer look at the questions on the back. As I mentioned, we really thought long and hard about these to encourage parents to think through what their family's greatest strengths are, and we kind of prompted them to think about what qualities and characteristics make their family special. And starting off with that was really important to us because there are so many great things in all of these families that we talk to, and we want that to be kind of a starting place of how special and unique each family is, and kind of build off of that for the future. Then we also asked them to think about what are their top priorities for their family's overall health and well-being, thinking about their relationships, their financial well-being, and also physical and mental health, which are all kind of the factors that we heard coming up over and over again. And then we also want them to kind of think through like what worries or concerns them about their family or those different priorities as they think about potentially growing their family. And then lastly, we wanted them to end on, what do you want your family to look like in 5 years? If that vision has more children in it, we want them to think about what they need to get there and go get those things. But if they feel like their family in 5 years looks like it does today, then that is also okay. Really kind of encouraging families to think through and get to that thought of it's your decision. And no matter what you decide, that is the best decision for you and your family. So what's next? Coming soon, we have a video on family planning after having a child with SCID, very similar to the information that is in the one pager. If you aren't familiar already, there is an animated series of videos about kind of a SCID journey on the SCID Compass website. There's 6, and they kind of walk you through a family's journey with having their child identified through newborn screening with SCID, through treatment, and after treatment, and it kind of ends with their little boy going to school and being happy and a young kid. And so we have decided to add another video onto that series about that family taking the next step. And it kind of, the script it's in development right now, but the script really walks through the different considerations for having another child, the different options for having another child, and also just encourages families throughout that process. And as I've said, these are kind of my final thoughts, but I'll wrap it all up. The decision to have or not to have children is an incredibly complex and intimate experience, and maybe even more so after having a child with SCID. And it's a complex and intimate experience always, but maybe even a little bit more after having a child with SCID. And each parent or family knows what's best for them. I've said that a million times, and I'll keep saying it because they know what's right for their family, and they are more than capable of making those decisions. And more resources and support for families wanting additional children after having a child with SCID could be helpful. So we created that one pager. We're working on a video, but I think even more resources in this space in the future could be helpful. So this is my contact information. If anybody has any questions or wants to reach out to me afterwards, please feel free to do so. But I just want to end by saying thank you so much to the whole SCID Compass team for supporting this work. And again, to the parents that took their time to share their experiences with us.
Wonderful. Thank you so much, Brianne, for giving us that kind of behind the scenes look at all of the important work that went into the development of this awesome resource. As you all see in the chat, Alyssa has actually shared the link where you can find our SCID Compass toolkit, part of which is this resource that we just shared on today. So we are excited about this new video that's coming out about family planning and SCID. We'll be adding that to the SCID Compass website as soon as it's ready to go, and we're looking forward to sharing that with you all soon. Thank you so much, Brianne, for this awesome presentation. And this will wrap up this session if we don't have any questions in the chat. And we hope you'll join us for our next session, which is actually going to be a parent's journey with SCID. So kind of a nice follow-up to this topic. And then our final session will be accessing all that SCID Compass has to offer. And there you'll see more about our toolkit, more about this family planning document, and all of the resources that we have to offer you through the SCID Compass program. So thank you so much, everyone, for joining us for this session. Thank you, Brianne, for all your hard work that you put into this presentation and the resource. And we'll see you at our next session at 1:10. Thank you so much.